Hey guys, this is Manu, physical therapist and Ayurveda herbalist. So I want to show you another video today on we're going to talk about heel pain, and more specifically medial heel pain, or inner side of the heel. So plantar fasciitis type issues. You can also have sometimes bone spurs in that area, or just irritation of tissues on that on the inside of that heel. So very often on the inside, and this is quite common, a lot of runners and other athletes too. So on the inside of that heel, right in there, here's your calcaneus, okay? Here's the inside of the foot, the outside of the foot right there. So very often you're going to have pain along this medial border right up through here. Here's your calcaneus, your heel bone. And so right in there, this area on the medial side is often very painful for people suffering from heel pain. This is different than the area back here, posterior part, where people get heel pain also. We're talking about this region, and then also from here further down, the plantar fasciitis type issues, where there's inflammation or irritation of that fascia or connective tissue and thick band, which supports your arch. Okay, so this technique is this is just to show you how to do that cross-friction massage or scar tissue mobilization to break down any thickening or adhesions that might have formed in this area. Okay. Of course, you have to address the underlying cause of the problem also, which has more to do with strength and motor control of your foot muscles, your big toe muscles, as well as having good or adequate ankle flexibility. If the ankle joint is stiff, or the big toe is very stiff, it's going to impact what happens in the foot and further up in the chain. All right, and it's going to affect those mechanics and also predispose you or cause some of these problems. So I'm missing that ankle range of motion, don't have that dorsiflexion. If I can't get that down far enough, I'm going to change my mechanics, the way my foot hits. It might do more pronation, maybe more towards a flat foot posture possibly, okay? Or the foot might want to drift out more, which is going to cause problems, possibly loading up that inside of that heel calcaneus and inside of that foot too. So not only local problems further up the chain too. All right. So for this technique, I'm going to show you it's pretty simple. I'm stabilizing through here. Now you can lay it down too if you need to. So I'm going to get in here, and again, we're doing scar tissue mobilization to break down thickened adhesed tissue, which is due to chronic irritation, possibly inflammation. The tissue gets all thickened and it's not moving properly, and it's adhesed or scarred down. There's lack of circulation in that area, and it's causing pain. Okay, so we're going to do scar tissue mobilization. I put a little pressure. I find those painful spots there. Right, apply pressure with my thumb, and I'm going back and forth. And it's a pretty small area that I'm moving back and forth. Remember, it's not just moving on the skin. That's not going to do anything for us. We got to put some pressure there and go back and forth back. So find sticky spots, painful sore spots, and you work along those areas. You might even sometimes find further up through here, you might find some areas. So get in there, not just there, search further down through here, other parts of the fascia, and work your way all the way through. So hang out 5 minutes, 10 minutes, work through those regions, okay? So next thing you can do is, of course, I can tack it down a little bit and do some tack and stretch. I can press, stretch the foot, tack and stretch. So free up any tissue that's been kind of bound up through there. You can stretch, tack and stretch. So I'm going to look at different areas along the length of the fascia that might be all tightened up through there. Okay, that can possibly restrict mobility also and proper mechanics. So I might put some pressure here. With my other hand, I'm going to do some tack and stretch, tack and stretch, tack and stretch, tack and stretch. Of course, this is a two-person technique, so you are going to need somebody else's help to do that. So I've shown some other self-treatment techniques or one-person techniques in the past to rest in that area too. So check those videos out. But this one is you do need somebody to really get in there and break that tissue down and then improve the mobility of that tissue. All right, so I hope you found that useful and it helps you. If you have any questions, leave a comment and subscribe to the channel. Share the video, guys, if you think somebody else will benefit from it. And make sure you click on the link to check out my site. I have tons of information there, and we got a really cool product that's coming out for athletes and runners. Make sure you keep track and checking on the site. You don't want to miss this one. All right, guys, thank you.